Hi, everyone. My name is Tina Aswani-Omprakash from South Asian IBD Alliance, also known as SAIA. Welcome to our Gastro Gyan Ask the Expert series. This is a new series of short educational videos, and we're thrilled to welcome Dr. Govind Nandakumar. Dr. Nandakumar, would you like to just introduce yourself?
Yeah, sure. So I'm from Bangalore, lived in New York for a long time, trained and practiced in New York, and moved back to Bangalore in 2015. I'm a gastrointestinal and colorectal surgeon with a special interest in IBD. I had the opportunity to go to medical school at Mount Sinai, which was where Crohn's disease was first described, and then happened to have mentors along my career who were all IBD specialists, and that's how my kind of affinity to IBD evolved. And happy to be here.
Great, thank you. So today we're going to be talking with Dr. Nandakumar about what to know as someone who needs an ostomy. So, Dr. Nandakumar, I wanted to ask you a couple of questions. With IBD, when and why might it be necessary to undergo ostomy surgery?
So when we talk about IBD, let's just break it down into ulcerative colitis and Crohn's. Ulcerative colitis is surgically curable with a total proctocolectomy. That is, we remove the entire large intestine. And when we do that in an emergency setting, or when we do that in the setting of a weak patient who's nutritionally depleted, been on steroids, we make a temporary what's called ileostomy. An ileostomy is a stoma that's made out of the small intestine. We allow the patient to recuperate. And then if they're a good candidate, then we do what's called a ileoanal pouch and a temporary ileostomy to allow healing of the ileoanal pouch. And if the pouch goes well, the pouch heals, then we close the ileostomy. So initially you would have what's called an end ileostomy, and then you would have a loop ileostomy. If we're doing it in the setting of a planned surgery for ulcerative colitis, we would make the pouch and the loop ileostomy at the same time with the aim of closing the ileostomy once the pouch is healed. In the setting of Crohn's, we try to avoid ostomies as much as possible. If the large intestine is affected in multiple segments, then we do what's called an ileorectal anastomosis, wherein we connect the small intestine to the rectum and remove the diseased portion of the colon. If we're operating in an emergency setting where we're trying to preserve bowel for the future, we may make a temporary ostomy. If the rectum is badly involved or the anus is involved and you have bad anorectal Crohn's, fistulas, etc., then we may look at a more permanent ileostomy with the aim of giving the patient a better quality of life. And one of the myths about ostomies is that, it hampers or worsens your quality of life, but that's actually a misconception, because if we're thinking about a stoma for a patient, it's usually because their quality of life is going to improve from where they are. Of course, it's a life adjustment, and many a times it's a temporary ostomy. There are situations where it may be a permanent ostomy.
I'm so glad you went into that, Dr. Kumar. I myself have an ostomy, and it is, initially my family was so against it. You're not going to get married. People are going to discriminate against you. It's disgusting. It's none of those things. And I'm really glad that you're sharing some of these myths and misconceptions. So in line with that, Dr. Nandakumar, I wanted to just understand a little bit about how do we cope with an ostomy in our South Asian society, where many people consider having an ostomy very taboo.
So just taking that as a general point, just for the audience, you can do pretty much anything with an ostomy. There is certainly a change in your lifestyle. There's an adaptation. Your routine may change, but I have CEOs who have an ostomy who fly all over the world. I have young kids. I've made an ostomy for a 5-year-old kid who go to school. There are Olympic athletes who've had ostomies. There are, other well-known personalities, models even, that sometimes need an ostomy. So it's an adaptation. It's not a step back. I don't look at it that way. Intimacy is also perfectly possible as long as your partner is able to adapt and understand life with an ostomy. For the South Asian population, I think one of the things that come up, can you go to a religious place with an ostomy? Is it clean enough to walk into a religious place with an ostomy? I mean, that's a cultural question. It's a personal question. But for the most part, I think it is. I think there are plenty of people who are, religious. Religion is a big part of their life, and they've been able to continue that part of their life with an ostomy without kind of violating any rules of their given religion. The other question that may come up is attire. Can you wear a sari with an ostomy? Of course you can. In fact, it may be one of the easier outfits to wear with an ostomy. There are also little things you can do as you grow with an ostomy. For example, if you have a colostomy, there are patients who learn how to irrigate and manage their colostomy, so they have very little output through the day. I know patients who manage their diet so that their ostomy is less productive when they're at meetings and maybe at social events. The other big thing is when patients come in, one of the things I tell them is, you go outside in the waiting room, you don't know which of those people have a stoma. So there's many ways of kind of helping a patient acclimate to living with an ostomy, getting on a train, getting on a plane, going to the market, going to your place of worship. And as long as you come to it with an open mind, you look at the ostomy as something that's giving you a new lease in life, giving you back your life. That is, when you come in with that attitude, then your stoma is going to be something that you appreciate rather than look down on yourself. And I think that's an important thing. And I think I never have a conversation with a patient in a binary fashion. It's never, are we going to do a stoma or not? It's, what's your life going to be with a stoma? What's your life going to be without a stoma? If you have bad anorectal Crohn's and you're not able to sit, you're not able to attend a meeting, you're returning to the hospital every month with an abscess or discharge from your anus, would you rather live like that, or would you rather have a stoma? If you are somebody who runs to the bathroom every hour, unpredictable, the medical term we use is tenesmus, which is urge to defecate. And that can be one of the most frustrating and one of the most uncomfortable feelings a patient may develop over time because of a diseased rectum, for example. Just imagine taking off on a flight and you'd have to go tell the explain yourself. Instead, if you have a stoma, you don't need to do any of that, right? But I think the stoma can definitely improve the quality of life when done for the right patient in the most appropriate way at the right time.
Thanks so much for sharing that, Dr. Nandakumar. Just as a patient, a Crohn's patient with an ostomy, all of those symptoms that you described, just brought me back to a different world of, God, I used to live like that. I don't live like that anymore, thanks to ostomy. No one needs to know I have an ostomy. I choose to be public about it. I choose to own my Crohn's, own my ostomy. But I think it's important for us to emphasize today that we can live fuller lives with an ostomy, and that it's not anything that'll set you back. I agree that there are cultural concerns. It's something that I've navigated. Same with intimacy. I am married, and happily so, even with an ostomy. And I think it's important to look at, the different kind of quality of life you can have with an ostomy. So thank you so much for joining us today, Dr. Nandakumar. We are thrilled to have you on this series. And we hope to have you back again.
Certainly.